we have Dr. K with us, Dr. Kevin Kavanagh. He is a retired physician and also the founder of a national organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
How was your weekend?
It was really good.
Well, let's talk about COVID. I hate to bring up a sore subject, but COVID-19 rates are rising in Kentucky and hospitalizations to go along with it. What can you tell us?
Well, that's correct. And I think that that's primarily driven by the BA4, BA5 variant. Right now, nationally, I would suspect it's comprising approximately 50% of the cases. And this is a variant that is causing increased hospitalizations. And as you know, with that, there is significant risks of long COVID. But it's also escaping immunity. There's a new serological study, which has been funded by the NIH and out of Massachusetts, which shows that antibody effectiveness against this variant, whether these antibodies are produced by vaccines or by infection, is only about 1/20th of that to the wild type virus. And so it's felt that this virus is pretty much escaping immunity. Fayette County is in the red, and CDC recommends, and so do I, is that people mask up, especially in indoor public settings. It's very important to do so. And when I say use masks, I mean N95 masks.
It's a tough sell these days, isn't it? I mean, unless and until we are forced to do that, are people generally going to wear masks, in your opinion?
Well, I don't think so. I think they've reacted the opposite way to mandates. The virus, however, doesn't care. So if you're at high risk, you do need to wear a mask, and this will afford you some good protection, but not as good as if other people are wearing it. Because as you know, we've stated from the beginning of the pandemic, the mask is most effective if the asymptomatic carrier is wearing it. In other words, you primarily wear a mask for others. I myself, because I'm very high risk, I'm doing primarily ordering online or curbside pickup. But you know, people coming out delivering the curbside pickup aren't wearing a mask. And I wish that businesses would kind of step up and say, hey, there are some high risk people here. If we're doing curbside pickup, that's not for convenience, it's for their safety. Let's wear an N95 mask on our workers. And I also think instituting a time period early in the day when people can go in, wear masks. Masks are mandatory, maybe just 1 or 2 hours in the morning, again, for high-risk individuals. Churches could also consider that type of intervention of having the first service in the morning being where masks are required. All of that would help to protect those at high risk. Other people are going to they're going to be at higher risk for not only hospitalizations from COVID, but also long COVID, which is becoming more and more of a concern.
Now, this may be a stupid question, and I've certainly asked them before. If you have long COVID and you took a COVID test, would you be positive for COVID?
Well, the answer to that is usually not, no. However, there is new research which is somewhat disturbing. It has not been peer-reviewed yet, but it is out of a reputable organization that has found in over 50% of individuals with long COVID, viral antigens in their serum or blood. And so it's felt like they may have a low-grade active infection. And these are some of the biomarkers that are starting to come about and are being discovered in people that have long COVID. There's another one from a research group out of Australia that's found a biomarker for those that have brain fog. So this is a real thing. It's not made up. And very disturbingly, Dr. Al-Aly from, I believe, St. Louis, from the Veterans Administration, has submitted another paper for publication on long COVID, which shows that it is additive. In other words, the more episodes you have of long COVID when you get reinfected adds to damage or burden of disease, which was already present from the first infection. And so all of this means that we really do need to take this virus seriously. Right now, our public's not doing that, and I'm concerned. Long term, I don't think that looks good because it doesn't look like this virus is going to go away.
And real quickly, we have one case of monkeypox in Kentucky that we know of. Is that right?
That's correct. And that's also somewhat concerning because the cases, both globally and in the United States, are increasing. For example, in the United States, on June 24th, we had 201 cases, but on June 6th, there were only 45 cases. And this is in the United States. And so it is increasing. This is not spread nearly as easily as COVID-19. But as you know, it gives you quite a nasty rash and disease, and there is a chance of being extremely sick or even dying of this, especially if you are immunosuppressed or otherwise have compromised immunity or bad health. And so we also need to take this seriously. Again, it means to really look at spreading of disease by fomites, washing your hands, making sure the environment is clean. And I also feel that businesses for all types of airborne diseases should be upgrading their ventilation. There's some evidence that monkeypox may be spread by airborne particles, but it's felt that to be a very minor mechanism of spread, mainly spread by close contact. And from what we can see right now, it's spread by male to male close contact or intimate relations. But that could change because this monkeypox virus is different from the monkeypox virus, which was around in Africa some 40 years ago. It has 50 more mutations, and there's a new article in Nature that says that it's had actually accelerated evolution. So we need to kind of watch it carefully, but right now it doesn't appear to be nearly the danger to the community that is being created by COVID-19.
Always good to talk to you, Doc. Thank you very much.
Okay, thank you, Jack.